Dear UnitedHealthcare, I want to help you. I'm Dr.EvanLevine, board-certified cardiologist. If you enjoy my stories, like, share, and follow. United, you're flush with cash and buying up medical practices across the country under your Optum division. But from what I'm seeing, you're really failing. I worked for you for almost 2 years. It was a horrible story. You neglected to get me an office for our cardiology program, and I sat in a hallway with a snack table and a laptop for over 8 months. There it is. I had no one covering my calls on vacation every day. Even on a ship or hiking in Ireland, I had the cell phone alongside me to answer calls. Yes, and you refused to reimburse me for the cost. Then finally, after finding an office for us, all the specialists, just 2 days later, you placed a busy medical practice in it when they were thrown out by their landlord because you refused to sign a lease. We sat there cramped together like sardines. You fired dozens of billers, managers, and then pushed out or fired almost all the specialists, including me. I left just as COVID hit. You made the lives of so many dedicated workers worse. The workers that live in your communities and, of course, told all their friends and neighbors how terrible they were treated. Look at the Glassdoor ratings. Oh, Lord, they're terrible. I hear dozens of more doctors and other providers left again after you demanded they work additional hours. Things have gotten so bad you now are hiring temporary doctors. One apparently that was so unprofessional you dismissed right away. Well, great care for your patients. The local leader who was responsible for much of this disaster, well, at least he's gone as well. You need to replace and fire many more, though. Yes, many more. Your leadership. Treating hard-working people, the billers, the local administrators, the nurse practitioners, the physician assistants, and all the medical doctors so poorly has hurt your reputation. Sure, the doctors who were partners and you paid millions of dollars for their practice are likely very happy, but even some of them picked up and left, albeit with a large bag of cash. Now, I believe with better leadership, kinder leadership, smarter leadership, your vision of creating the large Optum groups could be a success. That's right. Here's my plan to help you. Number 1, fire most of your current leadership. 2, create committees made up of doctors and other healthcare providers and administrators to lead the clinic. 3, appoint physician-friendly administrators who cannot hire or fire anyone without the approval of the team. 4, focus on ensuring a healthier working environment for all your staff. 5, employ providers whose role is to fill in at offices that are overwhelmed instead of hiring these unvetted doctors from some local company, and pay these doctors that fill in well. 6, encourage healthcare providers to work harder by paying them real bonuses, substantial bonuses. 7, pay providers for the days of vacation they did not use. 8, employ enough ancillary staff to answer the phones on 3 rings instead of 100. 8, give the providers a healthy physical environment to work in. Yes, not the snack table in the hallway, and a private office they can go to and work or even rest when they need to. These things may help. Now, for the doctors coming out right now and looking for jobs, here's my advice. Find a happy place to work with, a place with good leadership, where doctors and healthcare workers have administrative roles. Now, I was lucky to find such a place, but I suffered, as so many others did, under a very apathetic, I would say even heartless leadership of arrogant and, yes, foolish people who ran a corporate giant.